long time, clinicians only had mechanical tools at their disposal to help patients, like scalpels, forceps, needles, and prostheses. But with the introduction of electronics and computers, more and more devices are controlled or do their data processing using software. As a matter of fact, more and more devices are software. In the MDR, there are specific rules for classifying software. Article 3.3 of Annex 8 distinguishes two types of software. There's software driving or influencing a device, in which case it will get the same class as the device, and software that is independent of another device, apart from the computer it runs on, of course, which must be classified according to its own use and properties. Well, that's stated in Annex 8 Rule 11, which is in Article 6.3, since software is considered an active device. If the software is used to take diagnostic or therapeutic decisions, it will be Class 2A, unless, if such decisions, when made wrong, could cause death or irreversible negative consequences for someone's health. Then it's Class 3. And when the health consequences are serious or could require surgery to get fixed, it's a Class 2B. If the software is intended to only monitor physiological processes, it is Class 2A, or if the monitored process is vital and wrong monitoring could put the patient in immediate danger, the software is Class 2B. All other software is Class 1. That all seems quite straightforward, but do mind that if the software is a medical device, you must also check all the other classification rules for medical devices. And although many do not apply to software, there are some that do. For example, Rule 15 in Annex 8 states that any device used for contraception is Class 2B. Therefore, if some software would calculate based on someone's menstrual cycle when to have intercourse with a minimal risk of getting pregnant, that software would also be Class 2B. But of course, this would be a very unreliable form of contraception. Finally, if you need more support in classifying software, also check this EU guidance document. Sometimes several devices are combined and delivered as a system or a procedure pack for a common intended use. For example, a set of tools can be packaged together, so all instruments for a certain procedure are available to the clinician. This would be called a procedure pack. But a set of devices might also be sold separately, but with the intention of being used interconnected or combined, like this monitoring system. MDR Article 22 explains if and how such sets of combined devices should be classified for their joint purpose. In short, if all devices in the set are CE marked for the intended use that they have in the system or procedure pack, the set does not need to be CE marked as a set. However, if the devices were originally not meant to be interconnected or combined, or not meant for the purpose of the system or procedure pack, the set needs a separate CE mark. In that case, the set as a whole must be treated as a medical device itself and classified as such. Now, lastly, there are some special kinds of medical devices that get their own special classification rules. You'll find these rules in Section 7 of MDR Annex 8, as the name already suggests a bit. Be sure to read that section yourself, because we won't discuss all of those now. We'll just pick a few interesting examples. Take, for example, Rule 15, which states that all devices for contraception or for preventing transmission of sexually transmitted diseases are Class 2B. With implantable or long-term invasive devices, they're even Class 3. This rule exists because, for example, strictly speaking, contraception does not fall within the standard definition of a medical device. Because of Rule 15, condoms are Class 2B devices and intrauterine contraceptive devices are even Class 3. And another interesting example is Rule 16, which is about devices used for cleaning, rinsing, disinfecting, or sterilizing other medical devices. Because of this rule, your contact lens disinfection fluid is considered a Class 2B device. That's because according to the definitions in the MDR, contact lenses are invasive devices. since the surface of the eyeball is considered a body orifice. There are quite a few more interesting rules in Section 7 that apply to all kinds of devices that you even may not have expected to be medical devices at all. Various examples are given in the EU guidance document on classification of medical devices, with many helpful explanations for each rule in MDR Annex 8. It explains why X-ray films are Class 2A medical devices under Rule 17, and that the leather straps for fixing a prosthesis are Class 1 devices according to Rule 18. And did you know that salt water being used as a nose spray is a Class 2A device because the mode of action of the salt water is physical and not metabolical, and hence it falls into Rule 21? Well, now you do.